In New Hampshire, anyone with a symptom for COVID-19 can call their medical provider and undergo an evaluation for a test. And in many cases, your healthcare provider has the ability to perform the tests themselves.
And Governor Chris Sununu says those without a healthcare provider or insurance who are symptomatic can come forward to be tested for COVID-19 free of charge. 5 new remote testing sites operated by the National Guard in Claremont, Lancaster, Plymouth, Tamworth, and Rochester are now up and running.
When you want to test, your provider will send in a requisition to our central team. We will make contact with the patient. We will find out what location is closest to you, and then we will schedule you for an appointment. And just so that there's an understanding of the scope of what we're doing, between the 5 testing sites, we will have over 500 appointments a day.
Meantime, a modified stay-at-home order will be unveiled on Friday. The governor says there will be cautious steps taken to reactivate certain sectors of the economy that have been restricted, but he indicated today it is unlikely the state will take a regional approach to reopening.
Whatever we do, we're going to make sure that we can handle it and that the system can handle it. Right now, I don't know if we can separate parts of the state out by county. We might have to take everything statewide for now.
One of the constants in this pandemic has been the threat posed by COVID-19 to long-term care facilities. Public health officials reporting 2 new outbreaks today. And for more on that, let's go live now to Tyler Dumont.
Yeah, Adam, state health officials say they are actively monitoring more than a dozen outbreaks of long-term care facilities with the virus. Now, today they announced 2 of the latest facilities with outbreaks. They were identified as Hackett Hill Center in Manchester, where health officials said 23 residents and 2 staffers have tested positive for COVID-19. The other outbreak is at Mountain Ridge Center in Franklin, where DHHS says 13 residents and 2 staffers have the virus. Now, both are the latest among a total of 15 long-term care facilities that the state says has experienced outbreaks of COVID-19. The DHHS commissioner said today that as they continue to monitor these outbreaks, she is hopeful there will soon be improvements in screening at long-term care facilities to prevent the virus from getting inside.
The vulnerability of the patients in long-term care is significant, and the negative outcomes are significant. The best place to fight this virus for long-term care facilities is at the door, and right now we're using what we have: active screening, temperature control, very low threshold for calling in sick.
The commissioner added that they are keeping an eye on all long-term care facilities in the state and that even one positive case of COVID-19 is a red flag. We're live in Concord. Tyler Dumont, WMUR News 9.